So hello everybody, my name is Ryan, as all you guys may know me already. And my presentation is about interpersonal communication skills that nurse practitioners use in a clinic setting. The first question that we were asked is, how did you meet this person? I met Elizabeth when I started working here. And as I started working here, I noticed her great communication skills that she had as a nurse practitioner. She has taught me great skills to use, whether it's nonverbal or verbal communication skills within a clinic setting to give great patient care and to use within our clinic with each other. Another question we were asked was the setting of the clinic. I said that our setting was small, mellow. We have about 10 rooms and 2 offices for the supervisor and the case manager. And it asked me how many patients, or how many people actually worked here. There's 15 of us total, with 6 nurse practitioners, 4 MAs, 3 schedulers, 1 medical director, and a supervisor. And as the next thing that I was asked was the elements of our environment in the clinic. I said that there's active listening, concentrate, which is when you're giving your focus to your patient, whether it's patient care or checking in a patient. We're very compassionate. We have empathy for our patients. We're patient satisfaction, engaging, and very hands-on with our patients. And the 5 key things that I learned from Elizabeth was that a superior and subordinate communication is when you're talking to your supervisor or to the medical assistants. And a great example is how the nurse practitioners consult with the anesthesiologist about patients or how they can care for the patient. And another way is also how when you communicate with us as medical assistants. And with that, there's an in and out exchange, which is a way of saying when the anesthesiologist and the nurse practitioners consult, that is something that they do with each other. Out exchange within a superior subordinate communication is when Wendy is talking to us, or the supervisor speaks to the medical assistants and she has to supervise them. The nonverbal and verbal communication skills is something that I saw Elizabeth use with her patient by her body movement, her hand gestures. As she was going over directly with her patient, she was pointing to it, and that helped the patient understand her care a little bit better. And collaboration is a skill that we use to communicate with each other amongst the clinic. Whether it's different ideas or opinions, it's how we communicate with each other. Power is something that everybody has individually in communication. It's what sets you apart from asymmetrical and symmetrical power. And interprofessional teams is a teamwork. A team that works together well and has one goal and one goal only, to give great patient care. And that's it. Awesome. Did you guys have any questions?
No.
Okay.
Great job.